What we can do is solve some of the system challenges that general practitioners face. So sorting out premises, sorting out workforce, so coming together and addressing some of those challenges, and efficiency.
Conventional problems that general practice faces, recruitment being one of the big issues of that. How have you experienced that at Modality in Birmingham?
We still struggle to recruit, but what we've done, so in Birmingham we've got 85,000 patients and 19 practices, employ pharmacists, we employ physicians associates, advanced nurse practitioners, physiotherapists. So you're using some of elements of what is traditionally general practice delivered by GPs, but delivered by other health professionals as well. The model of care is, if a typical patient journey would be, if you've got an acute problem, you won't necessarily see your GP, you'll see one of the other health professionals, and our GPs are then freed up to deliver more proactive care and looking after those complex kind of cases.
Has that affected how long you're able to give to each patient?
We haven't sold it yet, but that's the intention.
Okay.
Yes. The intention is that a traditional GP appointment will be moved out to 15 minutes.
Okay.
And we're testing that model now as we speak. Our offer to our patients is a wider choice of, I shouldn't say modalities, to access their care. So absolutely, we're not restricting face-to-face, but a lot of patients, particularly for acute problems, you're busy, you're in your offices or you're working, whatever it is.
Yeah.
And so having a quick answer for those things, do I need to come in, or can I go to a pharmacy, whatever it is, can be dealt with remotely. And when you survey our patients, of those that switched, and sort of 70-80% of those surveyed wouldn't switch back.
Okay.
It still means there's a good 20 to 30% that aren't quite happy with the full digital system and they prefer the face-to-face. So it's not 100%, but then we wouldn't expect that anyway. As a society and as a profession, this is what we need to share with our patients. Really, the choice. So access and convenience. The flip side is those patients that need to be seen from a continuity point of view will be seen by the GP, but others may be seen by other professionals, not necessarily that GP.
Okay.
And so it's a challenge as a profession, and we're getting pushback from our patients who are used to the traditional general practice model. But I think as more and more GPs start to adopt that sort of model, I think hopefully society will start to shift as well.
David Cameron is voluntary contract for large super practices. Is it something you've considered?
Yeah, so we're part of through the Vanguard work, we're part of the 6 sites nationally that is pilot testing some of the thinking behind the new contract. So we're hoping to get first sight of that in a month or two. I think there are a number of key issues that we're looking at working with the NHS England around. So the reality of 7-day access for GP services, what will that look like in practice? The out-of-hospital integration piece, so how does GP surgeries work at scale? So in Modality we've got that figured anyway because it's a single organisation, but other federations, how do they interact with each other? How does GMS or PMS fit into that, and does it get ring-fenced as a unit within that voluntary contract, so that the elements of the voluntary contract are built above it, or is it kind of morphed into that voluntary contract?
Do you think that super partnerships are the way general practice has to go?
It's an interesting question, and so how do you kind of keep that uniqueness of that individual doctor-patient relationship, which is absolutely purist at a small practice level, but also accept that society's changed and demands have changed and convenience and access, all that sort of stuff, and quality is a non-negotiable commodity now.